Hello, I'm Michael Cornfield of 720 Strategies. Welcome to this We Work for Health issue briefing, building on SCHIP Reauthorization. Like all our issue briefings, this session is designed to help you talk authoritatively with your colleagues, stakeholders, vendors, and customers, with lawmakers and their staffs, and with the general public on matters of current concern to the biopharmaceutical industry and the nation. Today's topic is SCHIP, the State Children's Health Insurance Program. President Obama signed a 4.5-year, $32.3 billion reauthorization of this program into law on February 4. We'll look at what SCHIP does, what's new in the reauthorization, why pharma has urged passage for it since 2007, and how SCHIP advances key principles and core messages of the We Work for Health campaign. Here's an overview of SCHIP. It was established with the enactment of the Balanced Budget Act of 1997 with bipartisan support. Democrats supported SCHIP because it extended the public safety net to children. Republicans supported it because it had a fixed level of federal funding and allowed states to participate as they saw fit. This bipartisan backing was repeated last month for reauthorization. 40 House Republicans and 9 Republican senators voted for expanding and extending SCHIP. Most states, 44 to be exact, have opted into SCHIP. They either created a special SCHIP office or expanded their Medicaid program. The target population consists of children of working parents who cannot afford or are not offered health insurance. States set the eligibility levels, which have ranged from 150 to 350% of the federal poverty level, which was $35,200 for a family of 3 in 2008. So there are 3 key terms to remember in summarizing SCHIP to others: bipartisan backing, proven program, and state-by-state flexibility. A little bit of alliteration there as a memory aid: double B, P, and S. SCHIP was set to expire at the end of March 2009. As the new Congress considered reauthorization upon convening in January of 2009, the economic environment had taken a drastic turn for the worse. More than 4 million workers have lost their jobs so far during the current recession. That means, in many cases, that they have lost their health care insurance too. It is estimated that for every 1 percentage point increase in the national unemployment rate, 1 million people will enroll in Medicaid and SCHIP. In this context, SCHIP reauthorization became that much more vital to the health of millions of our most vulnerable citizens. States need financial assistance just to sustain existing services, let alone provide health care to children who suddenly need it. SCHIP reauthorization brings 3 good things to Americans. The first benefit is peace of mind for millions of families who can be assured that their children will receive essential medical care, regular checkups, immunizations and medicines, and instructions and exhortations on how to avoid or at least manage chronic disease. The law, by the way, includes special provisions to fight childhood obesity. At a time when all sorts of experiments and initiatives are being considered and put into play, SCHIP is an existing success. The second benefit: the new law doesn't just preserve the safety net, it extends it to what the Congressional Budget Office estimates will be an additional 4 million American children. The expansion of SCHIP will come as the result of greater funding and from money allocated to outreach initiatives and to rewarding states that boost enrollment. That will bring the total to 11 million children in the SCHIP safety net. And speaking of outreach initiatives, telling people about SCHIP is a good way that you can work for health. You never know when those listening to you include someone who knows someone whose children qualify for SCHIP but have not been enrolled. The government will do its part, to promote the program, and the Robert Wood Johnson Foundation has shown leadership on this issue as well. It's time for all of us to pitch in by making sure people are aware of SCHIP as an option. The third benefit conferred by the SCHIP reauthorization consists of refinements in the healthcare process. SCHIP directs the Department of Health and Human Services to develop new metrics and fund demonstration projects that focus on the quality of pediatric care. We all gain when best practices in medicine are created, confirmed, and shared. Pharma has backed SCHIP reauthorization since 2007. It stabilizes a successful healthcare program at a time of spiraling human need for financial relief. It reinforces the federal-state partnership, fundamental to the political viability of health coverage programs. And it embodies a realistic approach to getting us closer to the big goals of cost containment and universal coverage. So Pharma has supported SCHIP reauthorization for these reasons. Let's dig deeper. Here is a compact version of our industry's mission statement. As you've learned in this webinar, SCHIP reauthorization hews to our key principles. High-quality care. The law spurs it through its provisions to generate and disseminate pediatric best practices. Affordable insurance. More than $32 billion in sorely needed funding with a self-paying revenue source in the form of a hike in the federal cigarette tax. Patient and provider choice. SCHIP preserves a mix of public and private healthcare options. We think that's the way to go. Fighting chronic disease. That new initiative to combat childhood obesity is a good example. Finally, medical innovation. While SCHIP does not address innovation directly, it does make an implicit case for it by helping parents and children obtain the medicines they need. Now, in some situations, you may find it convenient to talk about SCHIP reauthorization in condensed story form, past, present, future. The law marks a bipartisan endorsement of a program that has worked for 10 years to help children gain access to quality health care and learn how to prevent chronic disease. It provides a strong safety net for some of our most vulnerable citizens at a time when they need it most. America's biopharmaceutical industry was proud to support SCHIP reauthorization and will continue to work to better the health of the nation. So in conclusion, it is worth saying thank you to the lawmakers who voted for the SCHIP authorization, by email, by letter, and in person if you have the opportunity. Town hall meeting appearances are an important aspect of the We Work for Health campaign. And it is worth spreading the word about SCHIP in your communities, in your social circles and congregations, at your workplace and public gatherings that you attend. It's worth saying that the passage of this law is a good example of the positive change we must pursue to reform healthcare in America. Until next time, I'm Michael Cornfield of 720 Strategies for the We Work for Health campaign.